weeks. This shows that simple public health measures work, even in the presence of variants. What matters now is how we respond to this trend. The fire is not out, but we have reduced its size. If we stop fighting it on any front, it will come roaring back. Every day with fewer infections means lives saved, suffering prevented, and the burden on health systems is just a little bit. And today, we have even more reason to be hopeful of bringing the pandemic under control. Today, WHO gave emergency use listing to 2 versions of the Oxford AstraZeneca vaccine, giving the green light for these vaccines to be rolled out globally through COVAX. One of the vaccines is produced by SK Bio in the Republic of Korea, and the other is produced by the Serum Institute of India. Although both companies are producing the same vaccine, because they are made in different production plants, they required separate reviews and approvals. WHO emergency use listing assesses and assures the quality, safety, and efficacy of COVID-19 vaccines, and is a prerequisite for vaccines to be distributed by COVAX. This listing was completed in just under 4 weeks from the time WHO received the full dossiers from the manufacturers. In addition to the Pfizer-BioNTech vaccine, these are now the second and third vaccines to receive emergency use listing. We now have all the pieces in place for the rapid distribution of vaccines. But we still need to scale up production, and we continue to call for vaccine developers to submit their dossiers to WHO for review at the same time as they submit them to regulators in high-income countries. On Friday, I mentioned WHO's new declaration on vaccine equity. Ensuring the rapid and equitable rollout of vaccines globally is essential for saving lives and stabilizing health systems. But it's also essential for saving livelihoods and stabilizing economies. Fully funding COVAX represents the greatest possible stimulus and is a rounding error compared with the trillions of dollars that have been mobilized in G7 countries to support their economies. I'm pleased that the G7, under the United Kingdom's presidency, is meeting this Friday to discuss vaccine equity. And I encourage all groups to sign WHO's declaration. And we must continue to build the demand for vaccines by ensuring people have the right information. A year ago, I said that we were not only fighting a pandemic, we were fighting an infodemic. In the past year, we have seen the real harm that can be caused when people are overwhelmed by information, misinformation, and disinformation. The answer is not just to fight misinformation and delete false or misleading statements. It is to listen to the real concerns and questions people have and to answer those questions with good information. That's part of the reason WHO holds these regular media briefings, publishes guidance, communicates on its social media channels and website, holds seminars with different community and professional groups, and more. Having the right information is essential in every outbreak situation. As you know, last week an outbreak of Ebola was detected in the Democratic Republic of the Congo. 4 cases have now been reported and 2 people have died. Yesterday, authorities in Guinea declared a separate outbreak of Ebola in the town of Gueke in the southeast of the country. So far, 3 cases have been confirmed among 6 people who reported Ebola-like symptoms after attending a funeral in late January. 2 have since died, while the other 4 are being treated in hospital. As you remember, Guinea was one of the 3 countries affected by the West Africa Ebola outbreak of 2014 to 2016, the largest Ebola outbreak on record. The outbreaks in Guinea and DRC are completely unrelated, but we face similar challenges in both. Both outbreaks are occurring in areas that have recent experience with Ebola and are benefiting from that experience in terms of capacity for surveillance, rapid response, contact tracing, community engagement, clinical care, and more. But both outbreaks are also in hard-to-reach, insecure areas with some mistrust of outsiders. I'm pleased to say that vaccination started today in DRC, and so far, 43 people have been vaccinated out of 149 eligible contacts, including 20 people who were vaccinated during the previous outbreak in 2019. WHO is working closely with health authorities in both countries to engage with the affected communities to enhance trust and acceptance. Ebola and COVID-19 are 2 very different diseases. Both thrive on misinformation and mistrust, but both can be stopped with proven public health measures, engaged communities, accurate information, and vaccines. Fadila, back to you. Shukran.
Thank you, Dr. Tedros. I would like to inform the media that they may have received by now a press statement on what Dr. Tedros just announced in his opening remark, WHO listing 2 versions of the AstraZeneca Oxford COVID-19 vaccine for emergency use. It's also posted on our website. I will now open the floor to questions from members of the media. I remind you that you need to raise your hand using raise your hand function in order to get in the queue. I would like to start by inviting Imogen Folks from BBC to ask the first question. Imogen, you have the floor.
Hi, Fadela. Thanks for taking my question. This is about travel, because traditionally WHO has always somewhat counselled against travel restrictions. Now, I know we're well down the road in this pandemic, but it's getting very confusing for people with different countries introducing different things. And your own WHO COVID-19 envoy this morning said he could foresee vaccine passports. Is that something the WHO thinks would be a good idea?
Dr. Ryan, you have the floor.
Thanks, Imogen. The Emergency Committee made temporary recommendations in relation to a number of issues to the Director General, and they were, I think, were quite clear that at this time, at the present time, I think they used specifically, they did not advise for the use of immunity certification as a prerequisite of travel. And that is because, number one, vaccine is not widely available and would actually tend to restrict travel more than permit travel. Secondly, we don't have enough data right now to understand to what extent vaccination will interrupt transmission, and especially the individual risk of an individual to continue transmitting disease. So on that basis, no. But I think the envoy may have been referring to a future situation in which we have widely available vaccination and where we understand more about the impact of vaccination on transmission dynamics, or if we get to 2nd and 3rd generation vaccines where we may have more impact on transmission. At that point, certainly, and we've seen this with yellow fever and other diseases, vaccination can form part of a long-term strategy for disease control and for the prevention of the disease potentially moving from one place to another, as we've seen with yellow fever vaccination requirements, which have been in place for a large number of decades now. So I would believe that is a discussion that will be had in future. It will be based on emerging guidance from SAGE, on continuing discussions of the Emergency Committee and the technical programs here. So no, we don't foresee this as an immediate requirement or need, but certainly one that will have to be discussed in the coming months.
Thank you, Dr. Ryan.
All right, key coming out of that briefing by the WHO today, the WHO giving emergency use listing of 2 versions of the Oxford AstraZeneca vaccine, giving the green light for these vaccines to be rolled out globally through COVAX. Also, the Ebola outbreaks, quite critical. Speaking about the outbreaks in the DRC and Guinea, totally unrelated, the WHO says, but vaccination started today in the Democratic Republic of Congo. We'll have a conversation about the Ebola outbreak in Guinea just shortly after 7 o'clock. You want to stay with that, but for now, sports news. Jobe is here. Jobe, Graham Smith, not too happy.